Hi, I'm Dr. Vakar, and my videos are about educating the pet owners and young veterinarians for better healthcare and management of pets. In today's video, I will be talking about the toxicity of permethrin for cats. Permethrin is a very common drug which is used for the fleas treatment and tick control for on the dogs. The permethrin is applied on dogs by spraying or by small spot-ons put on their fur, and wrapping the cloths dipped in the permethrin solution, uh, and then the dog is dressed up. The permethrin is very effective in controlling the fleas and ticks for the dogs, but it is highly toxic for the cat. We will be discussing how toxic is permethrin to cats. Number two, how does it affect the cats? Number three, what kind of symptoms will appear when the cat is accidentally given permethrin? Number four, how should you manage it at home? And the last one is for veterinarians, and that is how should you manage the case at the hospital. Next point is how does it affect the cats? Permethrin is a strong neurotoxin. So neurotoxins affect the central nervous system of the cat. As it is a neurotoxin, all the symptoms that will appear will relate to the nervous system, and those symptoms can be very dangerous and can make you freak out. The first thing is that can appear, that is hyperesthesia. Hyperesthesia means the cat will show very strong keenness and attentive behavior to everything at first. Secondly, there can be tremors and muscular twitches and convulsions. All these nervous signs can appear whenever there is the permethrin toxicity. The third most important sign is that the cat, the temperature of the cat will rise immediately, and that temperature, you should know it is not due to the fever, it is not infectious. Actually it is due to the high muscular activity, and we say it as hyperthermia. Hyper mean more, thermia mean temperature. So more temperature due to rise in muscular activity, not due to rise in fourth thing is the heartbeat of the cat will increase. That is technically called as tachycardia. So hyperesthesia, number one. Number two is seizures, convulsions and fits, high muscular activity at the same time, leading to number three, that is hyperthermia. And remember one thing, whenever there is hyperthermia, when we will later on we will control the seizures and fits, the temperature will fall off. So we will have to manage that as well, but it is later during the treatment. Thing is, they will increase in the heartbeat of cat. So how can you manage it at home? This is the most important thing. What is the immediate care you should provide to the animal? The immediate care include the 3 points, that all 3 points they are actually for decontamination. So remove the spot on. If you sprayed accidentally permethrin to cat, so just wash the animal with cold water. I would say lukewarm water or cold water, but I recommend cold water actually, if it is not cold there out there. So because if you apply the cold water, it will decrease the blood flow to the skin. So that is, it will decrease the absorption of further absorption of permethrin from. Second thing, what you can do at home is clip that area, is clip the fur from that area and thoroughly wash the skin. And if you sprayed that, you can remove all the fur from cat. And the third thing is wash it aggressively. So remove the spot on or spray or wash the animal. And the third thing what you can do is apply cold water on the body and rush to the veterinary hospital for immediate care and for the treatment so what the last point is, what is the treatment at the hospital, what how should we go for this toxicity. This is specifically for young veterinarians who are working out there or are under training. What should we do? We should approach the animal by 4 points. The first point is there should be seizure control, because the nervous sign or fits control, and for that the second thing is the temperature management, the third thing is detoxification of animal, and the fourth is supportive care. So the first thing is what we can do is for seizure control. For seizure control you should go for muscle relaxants or CNS depressant, but you should not apply the strong CNS depressant to animal, because they can cause a severe depression of the central nervous system, which is not recommended for cat. And listen, atropine is not as we all know that atropine can be used as a general treatment for toxicity, but it is not the case. In for muscle relaxation or for seizure control, you should go for methocarbacol. This is a general drug used as a muscle relaxant for human being as well. So intravenous methocarbacol you should apply. So the first is 50 to 55 milligram per kg immediately, but slow intravenous injection. And then about 30 to 300 to 350 milligram per kg in the first 24 hours, but you should not exceed from that. So this is if methocarbacol is not available, you can also use propofol or diazepam, which is a very common drug used for muscle relaxation as well. So the second thing is for temperature control, you should not use the fever medication, but remember one thing, if there is infection as well, so you can use that, but for that you will have to wash the animal and then dry the animal again. So there should be a balance between washing and drying, washing and drying, washing and drying, so just to maintain the temperature. So if the temperature rises, you should wash if you until the seizures are controlled. Whenever the seizures or fits or convulsions they are controlled, so muscular activity will stop, so uh, that will automatically control the temperature. Sometime the temperature can fall, so for that you can use heaters to maintain the temperature, but in medication is not required for that case. The third thing is what you should go for. This is for detoxification of animals. So for detoxification of animal, there you should go for aggressive fluid therapy. But there is one thing more, that is intravenous lipid emulsion. So you can get any intravenous lipid emulsion from the market, from the human stores, and you can give intravenously to the animal, but in slower or lower dose. Along with that, you should also monitor the blood for lipemia. So if there is the rise in lipid level, lipemia, so you can stop the intravenous lipid emulsion. So after decontamination, what is the sportive care? Sportive care is just for um, adjusting the diet as well as the strong fluid therapy, just to decontaminate the animal. So whenever there is seizure control, temperature management, aggressive intravenous lipid emulsion therapy, just to stop the because permethrin is lipophilic, so it will stop the further action of permethrin, because permethrin will bind to the lipid molecules. But you should monitor lipemia as well, and also the lipid media are very good for bacterial growth, so you should use separate intravenous catheter for that.